Why are lymph nodes important for kidney cancer staging? Imagine your body as a busy city with many checkpoints that help keep everything running smoothly. Lymph nodes are like small security stations scattered throughout the body. They are part of your immune system and act as filters for harmful substances, including bacteria and cancer cells. When it comes to kidney cancer, these tiny organs play a big role in understanding how the disease has spread. Kidney cancer, especially the most common type called renal cell carcinoma, can sometimes send cancer cells traveling from the main tumor in the kidney to nearby lymph nodes. This spread is called metastasis. Detecting whether the cancer has reached the lymph nodes helps doctors figure out the stage of the cancer. The stage tells us how advanced the disease is and guides treatment options. In the staging system used for kidney cancer, called the TNM system, the letter N stands for lymph nodes. If no cancer is found in the lymph nodes, it is called N0. If cancer is found in some lymph nodes, it is classified as N1 or N2, depending on how many nodes are involved and how the cancer has spread. The more lymph nodes affected, the higher the stage of the cancer, which usually means a more aggressive disease. Having cancer in the lymph nodes is a warning sign. It suggests that the cancer has started to spread beyond the kidney, which can lead to a worse outlook. Patients with lymph node involvement tend to have a higher chance of distant metastasis, meaning the cancer could spread to other parts of the body like the lungs or bones. Studies show that patients without lymph node involvement often have a better chance of survival, with more than half surviving 5 years after treatment. In contrast, those with lymph node spread may have survival rates as low as 5 to 38%. To find out if the lymph nodes are affected, doctors often perform surgery to remove and examine them under a microscope. This process is called lymph node sampling or dissection. Sometimes, imaging tests like MRI or CT scans are used before surgery to get an idea of lymph node status. However, these scans can miss small cancer deposits, so microscopic examination remains the most accurate way to determine if cancer has spread to the lymph nodes. While imaging can help, it is not perfect. Magnetic resonance imaging and computed tomography scans are useful tools, but they may not detect tiny metastases. Positron emission tomography scans can be more specific but are less sensitive for small cancer deposits. Combining different imaging techniques can improve accuracy, but they do not replace the need for tissue examination during surgery. Understanding whether the lymph nodes are involved helps doctors decide on the best treatment plan. It also helps predict how the disease might progress and what the chances are for survival. For patients, knowing their lymph node status can guide discussions about surgery, additional therapies, and follow-up care. In summary, lymph nodes are vital in kidney cancer staging because they reveal whether the cancer has spread beyond the kidney. Their involvement indicates a more advanced disease and influences treatment choices and prognosis. Accurate detection through sampling and imaging helps ensure patients receive the most appropriate care. Always remember, if you or someone you know is facing kidney cancer, consulting with healthcare professionals is essential for personalized advice and the best possible outcomes.